now we're going to learn about what is happening in our world right now. What is the state of homelessness? It is my pleasure to introduce our Executive Director and fearless leader, Caitlin Frumerie, who will give her address, the 2020 State of Homelessness. Caitlin?
Thank you so much. And now I get to practice with the technology. So I am excited to present to you the state of homelessness in Rhode Island. And, really as I reflect back on this year, I think this is the image that really works best. It has been a challenging year, full of violence in our streets, in, systemic racism that's existed for a long time, but is certainly really prevalent now more than ever, and in loss of lives with the pandemic. And a lot of what I'm going to talk about today is how troubled we are in the homeless system. But before that, I did want to share some good things, start off with some good things. So these are some things that have been good over the last year. We can now bill Medicaid for some home stabilization services. That's another funding source for our service providers. We have an increased focus on housing at the state and local level. Governor Raimondo and Christina spoke of that. We have fair chance licensing passed by the General Assembly, the Landlord Incentive Fund, and most recently awards in the state for the Runaway and Homeless Youth Program. So these are all some good things and progress that we're making, and it's not enough, but it can help. And the last good thing, at least for me personally this year, is I got a dog. I promised some of you that there would be puppy photos. You can see Lizzie here on the right helping me prepare these remarks. She's been an integral part of this presentation. So before I dive into the statistics, I thought I'd at least share some dog photos. So now I'm going to talk a little bit more seriously about homelessness in our state. It is getting worse, and really it's because of the gap between income and what housing costs in our state. And there is currently no city or town in Rhode Island where a renter with the median income in our state can rent an apartment. Not a single state, not even Central Falls. And so what does that mean? If you were making the Rhode Island minimum wage, which is, roughly $512 a month, you would need to be making, to afford an apartment, which you could afford would be $512 a month. So nowhere in this state, if you search on Trulia or Craigslist, will you find an apartment, 2-bedroom for your family for $512 a month. You can't even afford with a private sector wage to afford that $1,600 apartment, which is the average 2-bedroom, let alone actually purchase a home. And when we think about income, when we look at the homeless system, it's much more devastatingly low. So we see about a third of our families have absolutely no income when they come into shelter. And then the next highest prevalence is really in that 6,000 to 12,000 range. Imagine raising your family, your kids, on between 6,000 to 12,000 annually in today, not in 100 years ago when a loaf of bread was 10 cents. And what we're seeing in this data, comparing this year to last, is that we're seeing an increase in families' incomes. And I think this is a sign of how devastating the affordable housing crisis is in our state, that we are seeing more families with higher income because even they cannot afford an apartment in their community. And it's a similar trend, although less dramatic, with our individuals, single adults who are not necessarily in a family, but still who are working, who can work, who will work. And now I'd like to talk about homelessness over time. And you can see in this chart, the blue kind of greenish line is those residing in shelter, and then the red is our unsheltered. And this is an annual number. And you can see that it's declining, which is good, although shelter rates are a little bit misleading because really it's about how many shelter beds you have and not necessarily how many people are truly in need. And I think that's why the increase of people living outdoors and in places not meant for human habitation is so devastating, which is a 94% increase from 2020 to 2016. And when we look at those numbers by population, we see something even more terrible, which is that our families experiencing homelessness are increasingly staying outdoors. So we have families in Rhode Island in 2020 living in cars, living in campgrounds, living in parking lots, living outside with children. We also have children who are not in a family living outside or in shelters. And so that's an unaccompanied child. You might call them runaway youth, maybe it's from foster care or group home, but these numbers are increasing. And we don't talk about youth as much as we should, because that is something that we also are seeing increased youth homelessness, both for 18 to 25-year-olds and below 18. So what can we do with this? I promised I'd talk about some of the solutions. Well, first, we need to invest in youth programming and housing. They truly are the promise of our future, and if we are not investing in them now, it's not going to get better. We also need to increase investment in affordable housing. The bond, affordable housing bond, and dedicated funding stream both need to be in the state budget. And lastly, really allowing for a living wage. If people can afford to rent apartments in their community, they're not going to experience homelessness. So if we can pay people a higher living wage, it magically gets better because they can afford to live and be well. So now I'd like to take a moment and talk about our front door. And this is the front door into the homeless system. And in more technical terms, it's called our coordinated entry system. And currently it is operated in partnership with Crossroads Rhode Island, the Coalition, and the Rhode Island Continuum of Care. And I want to take a moment and thank all of them for their work in making this happen. It's been a project that's evolved over time. And what I'm going to talk a little bit now is when somebody presents to the homeless system, kind of what happens and what that looks like. So we have an assessment that's done when somebody enters into the homeless system. And this is typically done by Crossroads, or it could be done by an outreach worker. And as you can see, there's a dramatic number of people presenting each month that are seeking shelter or housing supports because they're facing homelessness or housing insecurity. And this changes dramatically month to month. So this is not something that is kind of consistent. You can have any number of economic drivers or a pandemic that will really impact why someone might need to lose their housing and come into shelter. So what happens when someone presents to that front door? Well, the first thing that we try to do is prevent homelessness. And I think that this is something that Crossroads Rhode Island and the number of other diversion providers across the country really understand that an ounce of prevention is worth a pound of a cure. And this means even more when we're in a pandemic. And so it's powerful that they are diverting and supporting as many families as they can from avoiding homelessness. But as you can see, if we have 50 on average coming in families a month, that 14 people is not enough. And that really means that we need to be investing in this. We need to be having more services and rental assistance for providers. Some people aren't able to avoid shelter entry and do need to come in. And this is another area where there just isn't enough support resources. And so you'll see that people presenting to shelter sometimes have to wait. Families may wait 15 days or more. Youth may wait 6 days. Veterans who have served our country may wait 5 or more days. And imagine waiting in colder months. You may be outside or just in a place that isn't safe. And when we're in a pandemic, this is even more challenging. So what can we do about this? Well, we need to increase the availability of emergency housing. And that is housing, whether it's a shelter or rental assistance where people can immediately move and not have to be staying outdoors. And we need to increase and prioritize programs that prevent homelessness. So that's diversion, legal representation, rental assistance. And we also need to continue the eviction and foreclosure moratoriums that can help stem the tide during this pandemic. And now I'm going to talk about the impact of COVID-19. I know that it's impacted us all, but it's really dramatically affected the homeless system. And first, I just want to talk about kind of age and risk factors for COVID. So here you can see that we have a wide distribution of different ages that are in our homeless system or living outdoors, including 154 children under the age of 5 in shelter and 13 children under the age of 5 who've stayed outdoors. We also have a number of people that are elderly. And we have a population that is at increased risk for chronic health conditions, developmental disabilities, and physical disabilities. What does this mean? It means that there's a higher incidence of COVID-19, and they're at higher risk for complications. The state of Rhode Island has a data warehouse ecosystem, and the Coalition for the Homeless and our database partner with them and collaborate with Medicaid, Department of Health, and all the other stewards of that system. And they've been tracking homelessness and COVID, and this is some of the data. We're lucky to report that 22% of our population has been tested, but 260 of those, of that larger group have been testing positive. That's a significant number for our community. That's 8% of the larger homeless population in the time periods we reviewed. And one thing I'll share is this data is through July 2020. This isn't reflective of our most recent data, which is showing an uptick in our system. We talk about this in our weekly Wednesday meetings. What's our latest test results? And we're seeing an increase in persons testing positive for COVID. And it's particularly challenging in the homeless system where there's more congregate settings and you don't have a home to return to. And certainly we also see higher hospitalizations with our populations because they have a disability. So this is of the hospitalizations, we do have a large number that are that do have a disability, and that can lead to all sorts of challenging health outcomes as a result of the pandemic. And this is a dashboard when you work with a partnership that just spells a little bit more into the data. And I will say that these slides will be available to you on our website if you want to explore them at a slightly slower pace and digest it. But this is just some information about our data warehouse. So what can we do about COVID and the homeless system? We need to maintain safety and continue a lot of the initiatives that we're currently doing. I also think we really need to seriously consider hazard pay for our shelter and outreach workers. They're putting their lives at risk every day, and we need to compensate them for that. And I also think we need increased COVID testing with faster results and hopefully a dedicated contract tracer for our system, because it is just a lot more complicated than the general population. And as we've reflected on this last year, I would be remiss if I didn't talk about the racial and ethnic disparities that exist within our system. We see that Black, Indigenous, and persons of other community of persons of color are disproportionately impacted. So we can see here that you are having a higher representation of Black and African Americans who are living on the street as opposed to our Rhode Island general population. And it's even more insidious when we look at those numbers for families. That is a dramatically different representation from what we see in our population versus our families who are living on the streets, who are majority of whom Black and African American, at least in this last year. We also see disparities when it comes to ethnicity. We have a higher percentage in really every level of our homeless system of families who identify as Hispanic. And these are really insidious examples of the systemic racism that has existed in our communities for a long time. So what can we do about this? We need to dramatically increase affordable housing and investment in these communities. We need to pass legislation that removes barriers to housing and decriminalize homelessness, and make sure that persons of color are at the center of all of this work and informing it and engaged and meaningfully engaged. And lastly, I want to talk about places not meant for human habitation. You've heard me talk a couple of times during this address about those living outdoors, and we are really at a crisis point for this in a level that I've not seen. So first I want to explain, for individual adults in particular, we have seen a decline of shelter beds. And this is because of COVID. We've wanted to make our shelters safer, so we have reduced the number of beds, which has led to a loss of about 146 beds. And we're now planning as a system for winter, but we don't know how many beds are going to be online for this winter. And what we have is 325 plus people right now in Rhode Island staying outside. This includes families, this includes individual adults. This is a 92% increase from last year. And we need to ensure that this winter that they are not unsafe due to a pandemic, unsafe because of cold weather, unsafe because they don't have access to home and support that everyone has a right to. What can we do about this? I need the state and our partners to stand up at least 200 beds right now of temporary and safe housing. And we're trying to work with the state and cities and towns to work on this, but we need all of your help to raise awareness about this issue. We also need to continue rent and innovative programs like the Landlord Incentive Fund. So lastly, I'll just ask, will you help us? I think I've laid out a lot of hopefully powerful and actionable solutions throughout this address, but we need you to get involved. We need you to get out and vote. We need you to speak with your elected officials. We need you to donate to some of the fabulous shelters and providers and partners that we've talked about through the address. I need you to donate to us and help us advocate for solutions that work. And remember that nobody can do everything, but everybody can do something.